guys, Ken and I are going to be Class 2 Antiarrythmics. My drug name is beta blockers and my chemical name is... I have 3 different generic names with brand names. I am available at the Philippines. First generic name is acebutol with its brand name Sectrol. Second is Ismolol with its brand name Reviblock, and third is propranolol with its brand name Endural, Enopren XL, and Novopranol. My drug classification for therapeutic is antihypertensive and for pharmacologic beta blockers. My pregnancy category is category C.
The mechanism of action engaged in competitive inhibition of beta receptors, specifically found in the heart and kidneys. For this reason, there is decrease in heart rate, excitability, and cardiac output. Conduction through AV node also slows down. In the kidneys, release of renin is decreased. These effects decrease blood pressure and stabilize the high excitability of the heart. As a result, workload of the heart is lessened. Pharmacokinetics. In oral administration, I have a 20 to 30 minutes onset, a peak point of 60 to 90 minutes, and a duration of 6 to 12 hours. Through intravenous administration, I have an immediate onset. I have a peak point of 1 minute and a duration of 4 to 6 hours. My half-life is 3 to 5 hours. The metabolism is in the liver, and I am excreted in the urine.
Indications. For children, antiarrhythmics are not often used for this age group. For adults, usually indicated for emergency cases, evaluation of drug regimen should be done carefully and regularly to ensure effectiveness and patient safety. Drug safety for pregnant women not established. This drug can enter past milk and has been associated with various side effects. Antiarrhythmics 1, 3, and 4 are strictly prohibited to lactating women. For older adults are more susceptible to drug toxicity because of underlying conditions that would interfere with metabolism and excretion of drug. Renal and hepatic function should always be monitored.
The contraindications. I am contraindicated in patients with severe bradycardia and sinus bradycardia, which have a heart rate of less than 45 beats per minute. I am also contraindicated in patients with second or third degree heart block. These conditions are exacerbated by the therapeutic effect of the drug. I am contraindicated in patients with heart failure, cardiogenic shock, asthma, respiratory depression. These conditions are exacerbated by blocking beta receptors. I am also contraindicated in pregnant women and lactating women because I can cause potential adverse effect to the fetus or neonate. I am contraindicated in patients with diabetes and thyroid dysfunction by blocking of beta receptors. And lastly, I am contraindicated in patients with renal and hepatic dysfunction because I can interfere with bioavailability and excretion of the drug. I have side and adverse effects categorized per body system. First, the central nervous system. I can cause dizziness, fatigue, hallucination, insomnia, confusion, dreams, fever, and depression. For the cardiovascular system, arrhythmias, hypotension, bradycardia, AV blocks, alteration in peripheral perfusion, chest pain, edema, and heart failure. In the respiratory system, I can cause bronchospasm, dyspnea, and wheezing. In the GI tract, anorexia, diarrhea, constipation, nausea, and vomiting. In the musculoskeletal system, arthalgia and myalgia. And for other body systems, I can cause loss of libido, decreased tolerance to exercise, alteration in blood glucose level, and rashes.
Before, during, and after, a nurse must be responsible in administering me to a patient. Before, you must assess for the mentioned contraindications to this drug to prevent potential adverse effects. Next is to assess blood pressure, heart rate, and rhythm. Conduct thorough physical assessment before beginning drug therapy to establish baseline status and determine effectivity of therapy and evaluate potential adverse effects. You must assess patient's neurological status to determine potential central nervous system drug effects. Assess patient's cardiac status closely to determine whether change in drug dose is imperative. You must monitor respiratory rate, rhythm, and depth to assess for respiratory depression and detect changes associated with development of HF. Monitor laboratory test results including blood count, renal and liver function tests to determine the need for possible change in dose and identify toxic effects.
Nursing responsibilities during drug administration are as follows. Titrate the dose to the smallest amount enough to manage arrhythmia to decrease the risk of drug toxicity. Assess blood pressure, cardiac rhythm of the heart to detect potentially serious adverse effects and to evaluate drug effectiveness. Provide comfort and safety measures to help patients tolerate drug effects. Ensure maintenance of emergency drugs and equipment at bedside to promote prompt treatment in cases of severe toxicity. Lastly, educate patients on drug therapy, including drugging, its indication, and adverse effects to watch out for, to enhance patient understanding on drug therapy and thereby promote adherence to drug regimen.
After my administration, the nurse must monitor patient response to therapy through assessment of cardiac output and rhythm, rate, and blood pressure. Monitor for adverse effects and evaluate patient understanding on drug therapy. And lastly, monitor patient compliance to drug therapy. That's all for today's video. Thank you for watching. I hope you have learned something. Bye!